It started 20 years ago with one doctor's room and one NGO. Ndlovu Clinic today specializes in the treatment of HIV and AIDS and receives more than 200 patients a day. People from the community don't hesitate anymore about coming in for treatment. South Africans know that life-saving medication is available. Access to antiretrovirals has revolutionized people's attitude to treatment.
Because first of all, the pills are free, all right? So they don't pay for it. That's one. And two, they kind of get the best available, the best available, at least compared to the rest of the world.
More than 2.5 million ARVs are distributed every day in South Africa. Treatment is almost entirely financed by the state. As government picks up the tab, donors are progressively withdrawing, and the NGOs are suffering. The founder of this clinic says funding is still needed.
The funders have become AIDS tired, and I think that we can't afford it to neglect this disease in Africa, because if we don't treat it in Africa, it will migrate to Europe where the treatment is available.
South Africa is ironically a victim of its own economic success, and donors are retreating. But providing lifelong treatment for almost 7 million patients is the greatest challenge facing South Africa's health minister.
I haven't had any country saying we've got as much money as we ever needed. So it will ever always be needed. But all I was saying is we've made sure that our own fiscus in the country finances 80% of the ARV program, so that if donors are still having their own problems, then we are not stranded, or we don't stop the treatment program. It still goes on.
In Ndlovu Clinic, new patients arrive every day. As private funding dries up, NGOs have to partner with government to cope with South Africa's HIV pandemic.